So hello everyone. A warm welcome to Homeopathy Musings. Good afternoon. Before going forward to our today's session, let's have a quick look at our upcoming modules. So we have animal series going on. It is a one-year module. It is already started in January, and till now we have completed almost insects, spiders, sea creatures, crustaceans. Mollusk is going on, and there will be a live session on mollusk on 29th of June. Registrations are still going on. If anyone want to register, they can register, and recordings of the previous sessions will be available. Then we have a very exciting course upcoming that is on metadonal remedies by Dr. Ghanshyam Kalathia sir. There will be total 8 sessions in the month of August and September. Early bird is going to end soon on 10th of July. So if you want to register soon. Then we have a very clinical upcoming session on autoimmune disorders by Dr. Dinesh Chauhan sir. Sir needs no introduction. It will be a 2-hour session on the 16th of August. That is on Friday, sharp at 7 p.m. Early bird is going to end on 31st of July. Then we have another clinical session, 2-hour session on cardiovascular disorders with case management by Dr. Adil Chimthanwala sir. It will be a 2-hour session on the 10th of October, Thursday, sharp at 7 p.m. So moving to our today's session, it will be a session on managing infertility cases with contemporary methods in homeopathy by Dr. Jyothi Udupi ma'am. About our ma'am, Dr. Jyothi comes with several years of knowledge in classical sensation and personal evolution methods under her belt. She is known in the homeopathic circle for her clinical wealth of knowledge and willingness to share. Today, she will be sharing the clinical tips on how to treat the difficult cases like infertility cases with the help of contemporary methods of homeopathy. So before starting our today's session, let's have a quick look at our basic hygiene factors. Please mute your lines all the while the speaker is speaking, as it will be distracting. Keep your videos on, which helps in interaction and avoid temptation to multitask. Raise hand while the speaker is speaking. All the questions and comments will be addressed at the end. Please do not scribble on the screen. Make notes, share your experiences, and enjoy. If you have any difficulties or technical errors, you can just contact to our coordinators, Asmita and Dr. Taskin, and enjoy. So I will just stop sharing and over to you, ma'am. Hello, ma'am.
Hello. Yeah, good afternoon. Thank you, Dr. Asmita. Shall we start?
Yes, ma'am. Yes, ma'am.
Yes. So let me share this. Okay. Yes. Good afternoon, everyone. I think most of you know who I am. So, very interesting, contemporary methods in homeopathy. Now we are actually really worried about, today's homeopathic education. Not much has been changed in our syllabus. On lighter side, I was asking one of the students who came to my clinic. I told her, tell me 5 drugs, 5 remedies from animal kingdom. There's a lot of struggle because many people doesn't know how to study through kingdom. They don't even know from where the medicine is, extracted. So we are actually, since 10, 12 years, we are very, very fortunate that all the today's practitioners know, we have many new methods to learn. Like first we learned sensation method, then we learned PM, now we have chakra, and so many new things are introducing in homeopathic field. It has become, very easy for us to practice nowadays. We are not only treating usual cases. Sterility was not a difficult case in homeopathy before. But with the new dimension we are practicing, we are helping infertility cases nowadays. You must have come across as cases where, parents or patients, they'll come and say, doctor, no problem in me, no problem in my husband, but still nothing is happening. We need at least one kid. We showed our horoscope. With all the due respect, we Indians know, if nothing happens, then we see the horoscope also. And that also we did whatever is told. But it is almost 10 years we don't have a kid. I'm very fortunate. I have a gynecologist near my clinic. Somewhere, no, 2, 3 cases clicked because of homeopathic, my homeopathic prescription. Nowadays, nothing happens. She will say, you go and meet Dr. Jyothi and come back to me. 2 IVF, 4 IVF. There was a patient who underwent 8 times IVF. Nothing happened. Because she was from the little, economically background, lower background, she couldn't fight with her husband side, who were very, very rich. They said, no, we are spending money, so you undergo what is there. I couldn't help her in conceiving this. But one day she stood and told her family, enough is enough. After giving homeopathic medicines, she said, please spare me. I cannot take this anymore. Because you all know how many side effects they are having. So in that way also, we can help through homeopathy. So today, 5 cases I will be showing. Let me tell you one thing. I'll be discussing only the symptoms which are very essential for this infertility. Although these cases are taken in detail, 30 to 40 pages, everything from the way they walk inside the clinic to the how they went out of the chamber saying, okay, crying, or I knew homeopathy can't do anything, but still my mother-in-law is forcing, or somebody is forcing. Till that time, I have all the symptoms. But because I wanted to show you more cases, only portion of the case, which is very, very important in selecting the remedy, is discussed. So don't think only 4, 5 symptoms and Dr. Jyothi is prescribing medicines, but only the case and how the medicine is selected on some set of symptoms. Only that is difficult. That is discussed in this today's session. So shall we start with the presentation? Case 1. I call my practice nowadays is more dramatic. Because I am not considering any, some of the cases doesn't have any symptoms pathologically. Everything is all right. Just allow patient to talk and take symptoms, take the nature of the patient, see how she is reacting to the situation. For the same infertility problem, each one has their reaction different. Somebody says, no, I can't go outside. Some will say, in what way it is going to affect me? Some will say, I am very happy because I am taking revenge on somebody. It is nice that it is not happening. So I give lot of importance to the reaction to the situation. Usual my question is, okay, I understand you are not able to conceive, Tell me, how do you feel? Then whatever they say becomes very important for me. So some cases, what you see is a dramatic cases. It is possible only because we allow patient to talk and understand how it is affecting her. So this is a one case which I feel is only through understanding of PM I could solve. Otherwise, all the cases when you repertorize gives you pulsatilla or thuja or lycopodium or something. But only because I knew PM, that is why I am very fortunate. I am practicing in this, era where so many new methods have come up in homeopathy. So this is female 35 years old, married since 10 years. No issues, tried IVF 4 times without any results. She is a MTech graduate working in college as a lecturer. She said, good sexual life, all reports are normal for the couple. Headache since 20 years, started when I joined hostel. I am very good in studies. Because I was studious, I think I am getting headache. Pain whole head, difficulty concentrating in everything. Almost every day I have headache. I feel better if I sleep in dark room. I am introvert, doesn't like interacting with people. Till I got married, I worked as a lecturer in college for 2 years. So she didn't speak anything about her, I want to become a mother or nothing. She was talking about her headache more. When I was studying my MTech, my mother got diagnosed with CA uterus. I was with her throughout the treatment. Chemotherapy was very painful. Now my mother is all right. My father is diabetic and hypertensive. No history of cancer in maternal and paternal side. She meant her mother's sisters, mother brothers, or my father's side. My mother worked as a teacher in government school. My father worked in a chemical factory. Doctor said maybe chemical factory was reason for your mother's cancer because they were staying in the colony which was, near that chemical factory. So husband, all my reports are normal. Even her reports are normal. Tried IVF 4 times but couldn't get results. So problem with my wife is she is never in present state. Always she'll be in different world. She says she has headache, but I think she is not there. She doesn't understand anything. I don't know how she did her MTech, but her report cards are excellent. Her mark sheets. I have met her friends and some teachers. They praise her a lot. She hardly stayed with me after marriage. She used to stay 10 days in a month and go back to her parents. This continued for 4 years. I used to visit her every weekends. She doesn't speak much. She says something happens to her head and rarely speak with others. Only after my parents shifted to my place, we are staying together. Otherwise, everything is normal. Doctors thought IVF is best for us as her ovulation and eggs were perfect. My sperm count is also normal. I am worried about baby. She has never expressed anything about this. I book appointments and she accompanies me. If it fails, no reaction from her side. Every time he told me, I'll be waiting to know how she reacts. Because the moment she comes and tells I got my periods, I'll feel disappointed. But there is no reaction from her side at all. I am unable to understand her. I need at least one baby. If one is having problem and can't conceive, I would have stopped trying because one of his cousin had adopted. So he knew because they cousin had a problem. So they came to conclusion that they can't go for any methods. So they adopted. So because I knew that family, he was explaining. She never said no to the treatment. Now also she has come to you because my mother asked her to visit you. Till this all okay? Okay.
Perfect.
Perfect. We'll continue. Mother-in-law. See how many people are involved in case taking. That mother-in-law belongs to our, where I practice, same place. She's quite famous in this area as a teacher. So she's the one who took appointment, and she was asking me 1 month before only what can be done and all. So she told me, I don't know what to talk about my daughter-in-law. Most of the time she is not here. Not here in the sense, not in the house. Whenever everybody is sitting, she is not part of the conversation. She doesn't react. She'll be in her own world. Always she'll be in the dream world. As my son also doesn't speak much, and he is always busy in work. He never complains of anything. But he can sense something is wrong with this girl, but don't know what. I took her to gynecologist. See, nowadays the other problem, I don't know whether to mention this or not. Sex education is so important for married couple. I have some cases where they don't know anything about, So being a teacher, meeting so many people every day, she thought she will take both of them and discuss with a gynecologist whether what they are doing is right or wrong. Even the safe period, whatever it is, she wanted couple to, consult gynecologist. We also went to psychiatrist because this girl is not there. Many of the time she thought she has some problem. He said she is introvert and gave some medicines, but she's daughter-in-law refused to take. One thing I want to tell you, doctor, she is yet to come out of her mother's health issues. Often she goes to her mother's house, although that the cancer treatment is over. So mother was also there. So I wanted to speak to mother. So she came and gave her history. By nature, my daughter is shy and introvert. She is very good student. All she got was a merit seat. She used to speak little when she joined hostel. After my illness, she stopped talking to people. As her father couldn't accompany me to the hospital, she took care of me. I have a son who is 10 years younger to her. He is very talkative. He has lot of friends. She couldn't take my cancer well. As some people had cancer in my township, I knew about treatment and side effects. See, even today I am fine. No problem. But she was very upset. She used to cry a lot. As I was teacher, I got some money from school for treatment. She stopped talking to people. She used to talk herself sometimes. I thought after marriage she will be okay. Now, who got the cancer? Her mother. How she is reacting to the situation? She is okay. She said, I knew about cancer. I knew about side effects. I have come out of the cancer. Yes. Shall we continue? Okay. So, how she reacted and how my patient is reacting to her mother's cancer. These things we learned from this contemporary methods. The question we asked, no, Makeup, if you want to confirm, I asked some of the patients, tell me there is one orphan in your family. Or we will be knowing, no, during conversation, we'll come to know somebody died. Or how does that baby feel? How is that daughter feeling after mother's death? So the symptoms they give, no, many times helps us in prescribing makeup. Because not necessarily she needs to be orphan. but she can feel for others as if they are orphan. Same thing here. Although mother had cancer, her reaction to the cancer was completely different from the patient's reaction to the cancer. So till now, I have not got, only these things I have got. She is not in this, not in the present. She is overreacting to the mother's cancer, whatever it is. Some things. But where this, infertility and other things, it is not enough for me. So what happens next? No strong and family and personal history. One thing was clear. Patient is very cooperative. If I give a chance, she will take me somewhere. Now, as Dr. Rajan Shankaran says, I am idiot, foolish, doesn't know anything about homeopathy. Such physician. You sit, talk, you take me where you want to take. So again, I call patient. I requested her mother-in-law, see, please don't come. I want to talk to your daughter-in-law. She was very happy. Very cooperative people I have around me. Since my menses are normal, no problems at all. I never had any major health issues in the past. I stayed in a township which had 4,000 population. Because of that factory, people had some health issues, but we were healthy. During BE, she was a BE and ME graduate. I was sent to hostel. I had only few friends. As I was not allowed to go out unnecessarily, I used to study well. Got good marks in UG and PG, all merit. When I was in final year of my PG, my mother got cancer. That is uterus cancer. I was shocked. Such a painful disease. As she didn't had much support, mother, she showed brave front. See how she is justified. Do you know how painful cancer and its treatment? I said, no, I don't know. My mother had so much of bleeding, lot of pain. She suffered many months. No one thought it is cancer. She also suffered in silence. You look at my husband's family. For my treatment, they are spending so much of money and time. So she means to say that I have got good support system, but my mother never had. They don't know I can't become pregnant. First time she is talking about something about pregnancy. It was not same in mother's family. No one helped her. She suffered in silence. She suffered alone. I couldn't help her much. I just stayed with her throughout the treatment. She was suffering within. Did mother talk anything like this? No. She didn't speak anything about pain or suffering or how difficult cancer was. Nothing. But daughter's reaction to cancer was completely different. This we can understand only through sensation method, PEM method. Whole consultation patient was talking about her mother's cancer and the pain mother went through. Every time I ask about her pregnancy and baby, I did ask her, see, you have undergone 4 times IVF. How did you feel when it didn't work? She didn't talk much about. Again, she would say, I can't become mother and baby is not for me. Big question mark again. I have fear of diseases, especially cancer. I have fear of losing my mother. I am afraid she will die not because of cancer, but because of pain. When I meditate, I see uterus, which is having cancer. For me, whenever I think of uterus, I remember cancer. Actually, in local language, no, she was very beautiful. Like she explained me very beautifully. How can I imagine baby inside uterus when I see cancer in the uterus? My uterus will not take baby as my mother had cancer. She had read somewhere, I have chances of getting cancer. I will have lot of pain everywhere. So it is so unreal and unusual for us to see such cases. If somebody had told about this, I wouldn't have believed. Because now we have other methods to understand patient, other methods to understand homeopathic remedies. It clicks, it just comes into our mind what she is talking. I think I got my headache after I started helping my mother during her illness. Pain in my head always. I cannot concentrate. That is continued till now. I can't concentrate in anything. I do my work. After marriage, not much work. Such a wonderful in-law, such a wonderful husband she is having. As I am very slow, I'll be thinking something. My head doesn't work most of the time. My mother-in-law and husband finish most of the works at home. I go for infertility treatment because my husband wants it. I know I can't have babies. I don't know how to explain this to people. Doctors say I have healthy uterus and ovaries. I am confused. When I know my uterus can have only cancer, how can I have babies? Was the question she asked when I asked her to meditate and go deeper. See why you cannot become. Because whenever I was asking her to talk about pregnancy, she used to say, no, I can't become mother. Doctor, motherhood is not mine. Beautifully she used to speak. But when she meditated, slowly went into this, she told me, my uterus is having cancer and cancer uterus cannot have babies. So whoever knows about PM, I think now know what I am talking, what patient is talking about. Anybody wants to give their input? Please, you are free to talk. You are not free to ask me questions, but you are free to ask. You are free to discuss. Anybody wants to contribute here?
Subclass 1.
Yes.
Old age, fear
Yes.
of pain. So numbing herself from surroundings. Opium.
Beautiful, but not opium. Beauty, you are almost touched.
I'm not able to put the headache. So my other DD would be
Rama, madam, is expert in PM.
Nothing.
Ma'am, you missed one word. First class, and where is my vessel? First subclass, she is asking, where is my vessel?
So okay.
If it were not PM, I don't think you would have thought.
Yes.
First subclass.
Absolutely.
Correct. Why it is so important to upgrade ourselves. Right? So
I would have been more confused than her.
No, I would have told the patient, I think nothing much can be done with your daughter-in-law. You forget about this. Very frankly, if with all this talk, if I don't know anything, I would have given some medicines. But somewhere I could have thought nothing much can be done. She doesn't want to become mother. Forget it. But homeopathy is so beautiful. We know something, so we can see so many things nowadays. So going further, so my analysis was, she is asking, where is my vessel? Vessel here is uterus. For my patient, uterus will have cancer, but not babies, because I have seen my mother suffering, headache almost every day, loss of concentration, patient not here, always confused. Concerning her sensitivity to pain and her great fear of it, led me to think about column 1, pre-separation, immersed and contained in the feminine principle. While ego is weak, obscured, dependent, easily influenced and impressionable. So sexuality in first column. Ego is still weak, and its ability to channel sexual energy into the physical plane is preliminary, because the containing vessel is not yet fully capable of handling the full force of the primordial sexual energy. Now, After talking everything, no, I had a great doubt about their sexual life also. Because son was always busy with the work. So I don't know how much they both, whatever they say, our sexual, this was normal. But I think too much of education, no, that modern view, modern this, maybe they didn't tell me 100%, I feel. There may be impotency or excessive masturbation, lack of sexual desire with generalized lethargy, aggravation during pregnancy and delivery. Uterus can hardly contain a pregnancy. The fetus does not hold, resulting in tendency to miscarriage. There are difficulties with conception and healthy progress of the pregnancy. Anything pertaining to reproduction is challenging. So, this suits perfect for first column and for my patient. Now, if I am considering PM, I have to see the age, what age she belongs to. So, we have rows, you have columns. First row, pre-life, unprepared. First row is more of womb. Second row is infancy. Third row is toddler. Fourth row is early childhood. Fifth row is school age. Sixth row is adolescence. Row 7 is young adult. Row 8 is middle adulthood. Row 9 is old age. As ma'am told, old age, my analysis was column 1, papaverels, which is in the last 3 rows. Here ego is too weak to act. Whereas row 7 spoke about young adult, row 8 was middle adulthood, and row 9 was old age. So I came to conclusion, I have to select a remedy which is from column 1 and row 9. That is old age. So remedy was Chelidonium majus. Dr. Rama ma'am, you forgot Chelidonium is a great medicine for headache.
Yes, yes.
Yes. So mostly symptoms of old age. I had to increase it to Chelidonium 1M. Patient was blessed with baby girl, 1.5 years now. It is, for me, it is a dramatic case which dramatically helped by homeopathy. These cases bring you a lot of other cases. Because people don't keep quiet. Because 10 years, nothing happened. First few years, they just waited. Then they tried one IVF. Each IVF costs so much. Then they want to breathe. Then again they try. But if she thinks her vessel is not ready, no IVF, nothing will help. So only after Chelidonium 1M, few doses, she conceived. But after she became pregnant also, she gave lot of, we were worried how she will look after child. But now, wonderful. She's a wonderful mother. So we'll read more about Chelidonium. It belongs to the family of Papaveraceae. The name comes from the Greek word for the word swallow, because its blossoming coincides with the time that swallows arrive and depart. It is said that swallows give the juice of Chelidonium to their young to improve their eyesight. These can be very practical, rather rigid people, non-intellectual with their feet on the ground. Now you can ask me, she was so good in studies. That is not that intellectual. How can you think because your mother is having cancer, I will also have cancer? Because my mother suffered, so I am always in the pain, thinking that cancer is a painful. So this type of thinking only we have to think. Anxiety of conscience is a major theme. They have a marked sense of good and bad. This is a Chelidonium plant. There is a great general lethargy and indisposition to make any effort. This is what family was telling. She's not here. She's not doing anything. She is always daydreaming. Aversion to mental exertion or conversation. Used by parents as pawns. A mother used her for her, father was not very cooperative. For everything, daughter was used. Frightened, dominant, competing, overprotective parents. Easily influenced and easy to control. Bitter and depressed about their situation. They cannot see the possibility of change. Very anxious inside, which is why they need the family always around them. Here, the sensitivity is to pain, which is experienced as unbearably intense, which brings us to the Papaveraceae family. So, three, this you can see here, young adult, mature adult, and old age. All three covered by Papaverales. And Chelidonium comes in the old age. People who doesn't know about PM, just go through this chart. As you see cases by cases, you will know. Any doubts? Any questions, Dr. Asmita, there?
No, ma'am.
Nothing, no? Can we go to case 2? Give me 1 minute. See, this is all indirectly helped cases. I don't have anything pathology to show you. Patient had so many ovarian cysts or nothing is there. Only because in spite of everything is normal. To see patient both were very healthy. Why nothing is happening? In that stage, that gynecologist used to send me cases. Go and meet her. She will remove all your blocks. Then you come back to me. So this is one such again. Yeah.
Ma'am, Dr. Rekha Srinivasan is asking, was any physical generals like likes hot water or something like typical children?
See, many things, that itself, chilly hot itself is very controversial for me. I don't consider all these things when I choose remedies. But I don't remember whether she was chilly or hot or... See, for me, I take different type of symptoms when I want to treat such cases.
Dr. Priyanka is asking if you can explain more about column 1 and row 9, little bit more.
Sorry. Because whole case, if I start explaining column and all, no. One case only we can cover. Sorry, see, we'll see in future sometime. Because it is very, not a small topic to talk. Sorry, Dr. Priyanka, we'll see in future sometime. Otherwise, we have to forego these cases. I have other 4 cases to discuss. We will see somewhere. We will teach you all columns and rows. Is that okay?
Yes, ma'am. Yes.
She agreed?
Yes, yes.
Okay. Thank you.
Ma'am, Dr. Vidhi asked, does her mental state of fear of cancer improved after the hysterectomy?
Improved a lot. Because she was laughing at, whenever I used to ask her, how is your mother doing? Said, come on, doctor. Actually, not mother. I needed treatment for that cancer. So the moment she started taking care of her daughter, all those thoughts, everything went. Only next crisis, we don't know. It may come up, but usually after our medicines, that doesn't come back. She was very much all right. She is very much all right. Now also I meet her. Whenever child has cough, cold, she comes and meets me. So she's doing very well now. She is not interested in going back to college as a lecturer because she said after 10 years I have given birth to this. I have become mother and her husband is really, they don't need money and assistance and anything. She said, I want to enjoy my motherhood. She's doing very well.
Okay, ma'am. We can go ahead with second case.
Second case. Female, age 23 years, born and brought up in Mumbai, daughter-in-law of a very big businessman in Chennai. Married since 4 years, husband is 30 years old. Issues of infertility. Same, both are healthy, doesn't want to try IVF. After all regular questions, I asked, tell me about your child. I had wonderful child. We were in Chal. In Mumbai, you know that our housing complex is called Chal. Used to have lot of fun. My mother used to prepare lot of snacks, which were liked by my friends. Then I later understood because, you know, they used to provide food. A lot of people used to come to their house and they used to enjoy. All the festivals we used to celebrate together. I and my sister used to participate in all competitions. It means they had a very good social life. I don't have many relatives, so I don't remember going out of Mumbai. So whole of my, most of my childhood and adulthood were in Mumbai only. When I joined college, I had best of my life. We used to go by local trains and hang out in beaches and did lot of trekking and other activities. I love adventure sports. I ride bike and car. Long drive with full speed was our entertainment. Many times my father, uncle used to accompany us. We used we used to enjoy partying. When I was in second year of degree, I got married. First few days were okay for me. Once my husband started going to office, I understood I can't do things which I was doing in Mumbai. People who doesn't know, Chennai is little, not much socializing, not much partying, a different little orthodox place. In the beginning, I used to go often to Mumbai and enjoy and come back. First year we didn't want a child, so we didn't plan. We had some planning. As days passed, I realized Chennai is not my place. No friends, no parties, no place to go. I couldn't go often to Mumbai. Where people will allow Only few months, okay. Then they start questioning, why you want to go to Mumbai? Lot of fights with the husband. I developed sleeplessness, was taking some pills. Although my family made some attempt to keep me happy, nothing excites me. So much of boredom. Given a chance, I want to go for a fast driving, eat street food. But we are big people here. They are quite big. Many people know them. Can't do anything. It is frustrating. I try keeping myself happy, but nothing works. So I think most of you know, it is a labiata family with ringworm miasm. See, this is one more thing we learned in today's, 10, 15 years. These teachings have really helped us in our practice. Again, this you cannot do through repetition. You have to know the thematic, themes, then it becomes very easy. So main sensation in labiata family is excitement. Excitement can be livid, pleasant. Tremulous excitement that stirs one to activity. In mind, the excitement can be seen as exhilaration, rush of ideas, loquacity, singing, etc. At the physical level, it is seen as a physical irritability and pain in shocks. The opposite is dullness, lack of interest, and decreased activity. Nothing used to excite her in Chennai. So she used to fight with husband because it used to irritate all these things what is happening around her. Whereas ringworm miasm lies between the sora and psychosis. The situation of the ringworm miasm seems to be one that is on the borderline of the patient's capacity. While not threatening, it was not a big problem, People will laugh at you if you say that it is taking time to adjust with this. What nonsense. Aajkal ka ladkiyan, they don't want to adjust on anything. But we have to respect whatever sensation they have. whatever reaction they have, it is good for him to succeed. So he tries periodically, but each time he fails, he gives up and accepts it. Thus, there are both resigned acceptance as well as the element of struggle. She never said, I don't want to stay in Chennai. But she always said, I am finding difficult to adjust to this type of living. So the feeling could be there is an effort to try and get excitement, alternating with a resignation. A fixed feeling that they must put up with having no excitement. So the remedy was Tucrium Marum. PD 2 days. After 2 months, I increased to 1 m. I gave her few doses monthly once. So this is the plant. So in PM, it comes in column 6 and row 7. They have a strong need to be part of whatever is going on, in the center of things, in the inner circle of the society. Yet, though friendly, they still need their time to be alone, as opposed to the first column, friendliness. Irritable before menses. In woman, polyp in the urinary system, vaginal and uterine polyps. But she never spoke about all these things. I don't know. Maybe if she had gone for proper checkup and all, this must have come in her. This multiple uterine polyps that prevent women from conceiving. So, both physically and mentally, I could help her. Although I didn't know whether what pathology she had because she never went for proper checkup. Column 6 and row 7. Me and the group. Strong ego. Powerful emotions versus control. The young adult. This is all symptoms of young adult. Desire for advancement, social achievement. Full of excitement and activity. Ready to live life to the fullest. एक ही जिंदगी है. Enjoy the fullest. I have only one life. I want to enjoy to the fullest. This is a plant from the Lamiales family. Rajan Shankaran uses the former name Labiata. He emphasizes the sensation, excitement, which can be vivid, pleasant, and tremulous. As a passive reaction, he names lack of excitability, absent reaction to external things, numbness, and disinterest. So, column 6, some of the themes. This is a stage of relationship with the group. This is the time where individuals classify themselves as me and the group. This is the leadership series, the King series. She did spoke, no? My mother's prepared lot of snacks. We used to give lot of snacks to all the friends. So they are all like leaders. I and the group. Strong individual I. Egotism, emotional suppression. So this is a chart again. See, you can see Lamiales here. This is young adult in the 6th column. Patient after the treatment, she not only conceived but also started liking Chennai. I have started loving my husband and my family members. She started doing activities here which gave her happiness. So even going to the temples, going to the her rituals, doing rituals, she started enjoying and getting some happiness through that. Now she is member of surfing club. She is very good in surfing now. I don't know how many people are aware. Chennai has one of the best surfing club in the, not only in India, in the world. If you have heard of Jyothi Rhodes, no? He's the one of the member of this surfing club and he helps teaching people how to surf. And surfing is such a activity which gives so much of adrenaline, no? So she was telling me, I never knew that I can do this activity which I couldn't do. So that basic young adult characters did not change, but she started enjoying things what she was doing in Chennai, like she was enjoying in Mumbai. So any questions in this case?
Yes, ma'am. Dr. Priyanka asked, please differentiate Leviata and Piperaceae.
The Piperaceae is first one, no? There is no this excitement there. It is more of
Pleasure.
pleasure. Thanks. Sometimes now I'm out of words. It is more of pleasure. Here they need that adrenal rush. Leviata has that speed car. I want to do things. It's like horse activity, no? But that is not seen in
Diksha.
Piperaceae. Yeah. Tell me, somebody was telling me something.
No, ma'am. It was just some unmuted rehearsal accidentally.
Yeah. So that is why that is in the first column and this is in the sixth column.
Dr. Jyothi is asking, please show slide of remedy.
This one? This one, Dr. Jyothi?
No, ma'am. The place where you had written Teucrium 200 and later you have given 1M. So I just wanted to know, even that point, at what point of time did you shift from 200 to 1M? So that was the reason for me to see the slide, ma'am.
Yeah. See, when I gave 200, no, she was okay. Like, whenever did you go to Mumbai? My question used to be like that. Was it so intense that you had to go? She said, no, I didn't go, but I am not liking anything here. So then, even this conceiving part was not happening, no? So then I increased it to 1.
Right.
She was okay to stay, but she was not showing interest to stay.
Lack of
So
interest.
that time, yeah, lack of interest. Okay, yeah, how many times I can go? Now that my parents are also asking me not to come like this, what will your in-laws think? What will your husband do? Don't do like that. So I'm okay to stay. That time I thought, no, she needs, little higher dose. And after 2-3 doses, monthly once only I gave, 3 months. Then she conceived. So then I stopped. I didn't give anything. Then after deliveries and all, she really started enjoying.
Right. Yes,
Yeah.
ma'am. Thank you.
Yeah. Shall we go to case 3?
Yes,
Definitely.
ma'am.
Definitely.
Yeah. Female, 30 years old, married since 5 years, tried allopathic medicine for 3 years to conceive. No results. She is married to Tamilian. Although she is Tamilian, she is born and brought up in Karnataka. She never liked her in-laws' house. See, this is what nowadays, even distant places, no? Forget about Chennai. Now that after Corona, everything is online. Many people consult you through online also. So, my first question will be, how are you? How is the place? What is that you like in that place? Please make sure you ask all these questions. Don't take things granted. Nowadays, children have, very vocal about their choices. It's not like 20 years back, you are destined to marry so and so. You have to adjust. Such things are not working nowadays. We have to upgrade ourselves. So I usually ask when they come with some problem, no? You usually headache problems and infertility problem. My general things will be first 10-15 minutes general talk only. How different it is from your place.
Thank you.
Who is that? So you please make sure you ask them how they are adjusting to the new place. So you get lot of symptoms there only. So this girl also said, I am a Tamilian married to Tamilian, but I am not from this place. I am born and brought up in Karnataka. I never liked my in-laws' house. So husband was, very getting irritated when she was telling all these things. She said she is always in her room. Only for food she comes out of the room. My mother does everything. She doesn't like any relatives coming home. because they will ask about her pregnancy. They will talk all nonsense according to her. They do lot of gossips. I don't like. So I don't come out of the room at all. My sister who stays nearby comes every day to see my mother. That irritates my wife a lot. But she doesn't speak single word with my sister also. She expects me to be in room always, which I don't like. Whenever husband is at house, she says, come inside the room. I don't want to be in the hall, which I don't like, doctor. I have other responsibilities as a son and brother. I don't think no treatment helps. Still, she changes her attitude because already has gone to so many gynecologists. She has taken so many, fertility pills. So he said, I don't think it will work. She should change her attitude. Some neighbor told that Dr. Jyothi does all these things. Why don't you take? We will see. Something may help your wife. So he came, but he had totally had lost hopes about his wife. She came to me because I belong to Karnataka and I speak Kannada. See, so interesting. Some cases, no? She also refused to go to other doctors. But that neighbor told, she belongs to she speaks very good Kannada. Why don't you go? She came running because she was missing all those things. Sometimes, no, you don't know from what this you get patients. Patient complained about her parents for getting married to her such family. She said, I just want to go out of this marriage as my parents have done a great mistake. They trapped me in this relationship. No freedom. The husband was little strict. Not strict, but he was little, moral values and all. I should watch TV that others are watching. Should eat what others are eating. I don't have freedom. I have TV in room. Staying in room makes me breathless. But I don't have a choice. It is so difficult. I have developed little asthma symptoms after coming to Chennai. I don't enjoy sex. I feel suffocated whenever my husband tries. Just because my parents doesn't like me coming out of marriage, I am staying with him. I asked her, why don't you speak to your husband? Why don't you speak to your parents? Why don't you come out of the marriage? Is it just to know, no? What is their view about that? She said, no. You don't know about my mother, doctor. She will not allow all such things. She will not allow me inside the house at all. So it is long time I went to my mother's place. I don't want to go. So she was talking about her childhood. My mother is a government teacher. I stayed with my grandmother most of the times. My mother would get transferred once in 3 years. I hardly spent time with her. My younger brother always stayed with her. My grandmother was strict and I had to do house chores. I missed my mother terribly. She never had time for me. I used to feel frightened in the nights, but no one used to sleep with me. My grandfather never allowed me to bring friends home. I was not allowed to go to friends' houses also. Whenever I met my mother, I used to fight with her because she loved her mother so much. So she used to fight. Even this marriage is fixed by mother. It means she never wants us to stay near me. That is why Chennai is so far. She was from the place called Belgaum in Karnataka. It's really far from the Chennai. So she said, she never liked me. That is why she got me married to such a, far place. My father doesn't speak at all. Everybody likes and listens to my mother. Only I don't get along with my mother. She doesn't love me at all. I don't have friends here. I don't have many relatives also. Every day my sister-in-law comes home. Mom and daughter keep talking. They both have a great bond. I never had that bond with my mother. Whenever I see them, I feel sad and depressed. I think that is the reason she never comes out of her room. The daughter also will stay till 8 o'clock, till her husband comes back from the office. she'll be staying there only. That used to irritate her more. I had bronchial asthma in childhood. After my menarche, I stopped getting it. My brother had primary complex. My paternal grandparents have bronchial asthma, diabetes and hypertension. My parents are healthy. I don't have problem in my menses. I get little pain during menses. No PCOS, my thyroid readings are all normal. I took medicines for 6 months to conceive, but nothing helped. All 3 times she took 6 months. That is why husband was fed up. He said nothing helps her. She has to change herself. She's not mother to my sister. How can she become mother? Her, his this. She should. Sister-in-law is a second mother to the girls, but she is never acting like that. How will she become mother? He was very angry, very irritated. So I gave her Drosera 200, and all such cases, no, 1M we have to give. After 4 months, patient asked me to suggest a good gynecologist for treatment. But husband strictly told, doctor, nothing doing. I am not taking her to any gynecologist. Then she was doing good. She started enjoying Chennai. So she also stopped coming to me because I also did not suggest her any gynecologist name. I said, we will see. I met this patient after a few months in one supermarket. She was with her parents. She introduced her mother to me, and she was 3 months pregnant. Then she delivered a baby girl, and her mother came and met me. She said, actually, this family and this boy is really good. So as we, anyway, one or the other day, we are coming and settling in Chennai only. So we thought she doesn't get better boy. So we got her married. But I didn't know, doctor, she hated me so much. I think after some months, she must have told her mother, I hated you. I told all these things to doctor. So after Drosera, things became really good and she became pregnant. So this is a Drosera. Drosera is a one more drug which we used to give only for cough before knowing all these methods, sensation method and other methods. It was not used so extensively for other. Even for psychiatry, Drosera is a wonderful drug. Carnivorous plant with tubercular miasm. Main sensation of this family are deceived, lure, constricting, pressing, suffocation. Tubercular miasm, the main feeling is sense of oppression. It is feeling that one's weakness is being exploited. Anyhow, my parents are far away, no? This mother, daughter, son can do anything. But that was not the reality. It was her sensation. The reaction is violent, almost tending towards syphilis. Main feeling of this family with the tubercular miasm could be oppressed and trapped by constriction and spasmodic sensation. So this was a sensation. This PM, this remedy belongs to column 4 and row 2. In one of the super class lecture, Dr. Rajan Shankaran had told, if mother doesn't like children, then think of mammals. If children doesn't, especially daughter, doesn't like mother, think of column 4, Delineate. So this is not some tricks, tips, helps you actually. Column 4 is the stage of nutrition and the close mother-child relation. Here, most of the plants have to do with nutrition and all food products, supplying nurturing care in the basic necessity of life. Issues relating to mother or motherhood, ability to give care, nurtured and protect or its absence, to have or not to have. So if you see, this is row C, D, A. This comes here, infancy stage. Saraceniales is the family, in that Drosera is one of the remedy. It is at this intersection that the Saracenials order is located. Carnivorous group of plants which have evolved to consume insects due to inadequate nutrition, lack of nitrates in the acidic soil in which they live. People who doesn't know PM, it is really new for you. Please go through. There are a lot of videos in this. Lot of courses are happening for PM. You can join. It's really worth learning PM. So many cases solved after I started learning PM and practicing PM. So it is a wonderful thing actually. The remedy that fits this case is Drosera, whose essential feature is sense of perpetual disappointment by a close one on whom one nevertheless depends, which leads to general mistrust of others. Because she said, no, everybody likes my mother. Everybody listens to me, listens to her. So my whole thing was depending on my mother. If my mother lied to me and betrayed me, then in whom can I put my trust? This is her feeling. We don't know the truth. As mother told me, it was not that I didn't like and put her in a Chennai. I thought eventually we will be settling in Chennai. So it is better she goes to Chennai and settle so that we can be. And she told me after delivery and all, you know, my mother is so nice. Whole pregnancy, whole delivery, she was with me. So it is only the patients. This don't believe patients 100%. Huh? If they say my father was this, that, don't believe. It is patient's reaction, patient's sensation. That's all. In the table of plants, the column relating to nurturing is the fourth column. It relates to the ability to maintain equilibrium with the nurturing feminine quality, which translates into the ability to give and receive without feeling short or deficient of anything. When the nurturing column meets the infancy row, that is second stage, at which the child requires for its development rest, sleep, love, warmth, and food in order to gain basic existential security. The resulting feeling is that of not having received one's basic life needs. This is for people who doesn't know PM. This produces a fundamental sense of lack, mistrust in life, suspiciousness, isolation, and hopelessness. Because of all these things, she used to stay in the room, never came out of room. But husband was very, very adamant that I will not come and sit in the room because I want you to come out of this state. There is an expectation of being betrayed, and any disappointment shatters their world view. This feeling becomes more acute when their basic needs truly have not been provided. Yes, her mother was not there. That is the truth. But she thinking mother never loves me was something which you need to cross-check. Rubrics, mind injustice cannot support, forsaken feeling, ailments from grief, carried, desire to be carried. She wanted her husband to be always, pamper her, take care of her. Delusion betrayed that she is of. Delusion, vexation, offenses of. Thinking, complaints of his aggravates. So, more about Drosera. They feel threatened all the time. Daughter, sister-in-law sitting outside is a big threat to her. They have the feeling that they can be attacked at any moment, which is only better when they are with their own group. It is a situation of gangs, groups being in war with each other. In the group, one can feel relatively safe, but outside it is dangerous. And the group as a whole can also be attacked at any time. So they are suspicious, easily angered. They have the tendency to fight immediately. The first strike is worth $1. They have the feeling they can kill people. They do not feel respected since birth, and that will never change. So more about Saracenials. Road to existential insecurity, mistrust, hopelessness, sense of failure, trap, a feeling of being lost, helplessness, despair because I can't get out, no way out. So I have to feel breathless inside the room. Drosera belongs to the genus of sticky trap plant. Beautiful colors and sweet nectar attracts unsuspecting insects. Tentacles located on the leaf have a sticky dew that helps to catch insects, which are gradually enzymatically digested and eventually absorbed by the plant. So many videos are there. You can see how beautiful nature is. Shall we go to next case? Any doubts? Hello. सब सो गए.
No,
Please, ma'am, waiting for the next one.
Next one. This is actually two male cases. Indirectly, how I helped such cases. Female 33-year, secondary infertility. She knew she is not the reason. See, sometimes, no, some aunt, some friend, somebody brings the case. So they don't know what to. Somebody told you are a good doctor, I came inside. But they don't know how to tell because other people are there. They cannot, although I say if you want, you can sit. They say, no, it is okay. But they bring lot of, other things also with them. So she didn't want to reveal about her husband's problem. She knew she is not the reason for infertility. She told everyone because I have PCOS, I have thyroid problem, I have difficulty in conceiving, which she never had. But she told people around her, we have that, no? We don't want to label husbands. Some of the ladies are too good ladies. So later over the phone, she took my phone number and all. She told me how to consult you. I want to take appointment. Then I want to come. Okay. So she told me over the phone, doctor, actually the reason we know it is my husband. So he is having a low sperm count and he needs treatment. Can I send? Said, okay, send. 37-year-old, married since 6 years. He came with a big file. He has fallen sick very often. Frequent urinary infection. He said, doctor, I am in marketing. I travel outstation a lot. Maybe because of this, I get frequent urinary infection. I had injury to my scrotum few years back when I was traveling in crowded bus. Sometimes I get pain in my right scrotum also. My sperm motility is less. Because of frequent urinary infection, I have burning and pain in my penis. I am really tired consulting doctors. Even I did scan to see how my prostates are. But prostate, no problem. Because nowadays, no, for all urinary infections, we are asking people to go for PSA and prostate also. Because maybe the primary infection will be in prostate and we will be treating only E. coli infection. So he went for scan also, nothing much problem. How is this problem affecting you? My wife's family thinks I have some sexually transmitted disease. I did consult urologist for that. But it's just, he said, no, you don't have any, I don't have any such. He was giving, repeatedly, I don't go to other people. I am not like that. But they think I have some sexually transmitted diseases. So urologist also saw, no, it is just an infection. They keep asking me indirectly about my problem. I feel irritated and it really hurts me a lot. How can they insult me like this? Although, see, this is a problem because his wife should also say, no, it is not like this. But somewhere he feels wife is also not supporting. So they cannot insult me like this. My wife also had PCOS problem. I don't know when. Because the wife said, I don't have any problem. I or my family never spoke about that. I'm very angry on people who unnecessarily interfere with my issues. So he showed me lot of his, so many times he has gone for urine culture and he had infections also. How these infections are not allowing him to have a sexual intercourse with the wife, how it is painful. All those things he told me. But I am, doctor, let me tell you, I never went with anybody. I cannot have sexually transmitted diseases. But my in-laws, my brothers-in-law, my other people always, indirectly will be asking me, is it that reason you are getting infection? So that, really irritates me. It really haunts me. So I thought of, because of his sensitivity, I thought of plant remedy. In that, I thought of Ranunculaceae family with syphilitic mass. Sensation of this family will be extreme sensitivity to mortification, indignation, and insults. At physical level, the pains are very sharp, stitching and stinging. Sensitivity is so high that it cannot be sustained, and the consequence is an outburst of emotion or bluntness. Term trifles is important here. Syphilitic miasm, the situation is desperate and hopeless, and I can't cope. Main feeling will be destroyed because of vexation and anger. Then later I heard from wife. She said that is the reason I didn't tell in front of anybody that my husband needs treatment. Because the moment I go and tell him I have spoken to doctor, he will feel really restless. He will say, why do you think I am the reason? All these fights, doctor, and these people also will not keep quiet. They keep asking me, is your problem better now? Then he'll get upset. So that is the reason I came home and called you. So I think a lot of, irritability was there in him generally because he is very sensitive. So medicine was Clematis erecta, but I had to give him lot of doses because it was so chronic. Some chronic cases requires lot of repetition. So I had to repeat. So gradually I decreased the doses because number of attacks and severity came down. See, there is a one method where you give many doses. Then you stop giving. Then you start giving whenever there are the symptoms. But that time you need not give many doses. Give 4 doses, they are better. Then you wait. Severity also they say, Doctor, I'm much better than last time. I quickly came out of that problem. So eventually his sperm count also increased. And he also became, little happy, and he started mingling with people. Wife was also very happy. So he became a father of baby boy after 1 year. So indirectly, it helped his wife to conceive. So what is Clematis erecta? Aversion to coitus. Testes indurated with bruised feeling. Testes hang heavy or retracted. Burning in penis during seminal discharge in coitus. Swelling of right half of the scrotum. Violent erections with stitches in urethra. A remedy of much importance in disturbances of sleep and neuralgic pain in various parts. Ailments from continued criticism and anger. Lack of forgiveness. So it comes in, ranunculus. This remedy comes in early childhood. So column 1 and third, 1, 2, 3, fourth row. Early childhood. It is also batch flower remedy. So it is given for irritability, especially sleeplessness, I think. This remedy is used very widely in batch flower practice. So anything you want to ask in this case before we go to last case? But here we saw a lot of, pathology also in this case. But I also considered his other symptoms, his sensitivity, his irritability, his, insult, anger, everything, and then gave him the remedy.
Very close to staph.
Yes. But
the pathology was what
yeah,
made me
sphere
choose.
of action, if you say, then I think this was very close.
Yeah, more so.
Yeah. This last case is, something really. I was very fortunate, that I am a homeopath, because this is a family actually. One of them, one of my relative. So that those people stayed in different place. After they transferred here, somebody told the girl, why don't you meet Jyothi Akka? She's doing lot of work in this. You go and speak to her. This is one of the wonderful case in my practice. Female aged 29-year-old came to me with infertility. She said, I'm married since 4 years. She has taken a lot of treatment as she had PCOS, and people, you have a better doctor in outside the society and the doctors. So they said, no, it is only because of PCOS you are not conceiving. Couple of consultations, she was talking only about her complaints. She said, no, I am not getting periods. So I gave her pulsatilla first, 1 m, and nothing was happening. Then I gave pulsatilla 10 m. She started getting her menses regularly, and she lost 10 kgs. Then also nothing, what she had come did not happen. So her main this was infertility. Then I always used to tell her, first you will see that your periods are regular. Then we will see what we can do. Then once she reduced, then she started asking me why I am not her mother-in-law used to ask me, now she is getting periods, no, why she is not conceiving? So one day I asked her, tell me what? See what she said. She said, I think my husband needs to be treated. Doctor, we never had sex in 3 years. How will I become pregnant? He asked her, why did you take treatment for 3 years when nothing is happening? She said, I love my husband so much, I couldn't tell anybody. She said, I have developed confidence and my husband wants to consult you. I couldn't believe this, as it was like a movie story. But as a homeopath, I was not surprised. Ask me why. Tell me why I was not surprised. Why she told me she did not tell people before? What is pulsatilla? Pulsatilla is a psychotic miasm, no? If you know. Most of you know. So she was hiding it so much. But after pulsatilla 10 m, she thought it is a time I should tell somebody that this is not going to happen. How much medicine I will eat? So I am going to tell Jyothi Akka the truth. Because she must have asked her husband. I think I have to tell her. You have to now go and consult. I was really happy. Okay. Homeopathy medicines works. So she told me that he said, I don't know how to do it. And I have shown him so many porn videos and all. I tell him, this is a way. He's not interested at all in seeing them also. He said, geez, shut up. I don't want to see all those things. So how can I become pregnant, Akka, if she is not performing? What to do? He's not at all interested. See what patient says. 31-year-old, he came straight into the story. Said, I know my wife was this. I never want to be a man. I hate my father. My father was very strict and used to put lot of rules. In his house, they were so orthodox. Everybody should get up 4 o'clock in the morning. And 4:30, 4:45, there will be puja in the house early morning. And every should be there for Aarti. See, I am going for a job. I was studying engineering. Nothing counted there. My father was a Hitler. So everybody should be there between 4:30 to 4:45, irrespective of whatever it is. So he used to hit me and my brother a lot. We are from very orthodox family. And we are forced to follow a lot of rituals daily, which used to cause lot of restrictions in my activities. I felt my father is harassing us. Whereas he was very sweet to my younger sister. No rules for her. She was given all the freedom. I used to fight with my mother a lot because he cannot show his anger, frustration, harassment, whatever on father, because he was very strict and he was very well off. Everything was depending on father's decisions only. So his all anger was on his mother. The day my sister ran away with other caste boy, I was very happy. You should see the way he explained to me. Doctor, that was happiest day of my this. And this marriage also was not my choice. She is a very good girl, no doubt. But I never wanted to marry at 24 or 25. But my father wanted to get me married because that is our culture. You get married early so that, you will become father early and things will be early. When my sister ran away, I felt I was liberated. I felt I was stuck and not able to move forward from that situation. My wife think I don't know ABC of sexual act. But I am taking revenge on my father by not doing anything. In this era, doctor tell me who doesn't know. It is such a natural act. I know everything. But by doing that, but he used to pamper his wife a lot. Huh? Really, I used to feel so good to see them. But this, because once I do, I'll become father. I don't want to give that happiness to my father. I just don't want to do. I feel stiff and paralyzed when I think of that. I am not interested. See, only I think people speak to all these things to homeopathy. That is why many people say, no, don't go for counseling. Go to homeopathic doctor. Because she does both. Counseling as well as medication if required. If you talk to counselor all these things, no, I don't think it would have helped him great this. It was very difficult case. You ask anything, he used to come with about his father. You know what my father did? I know what I did. All this, you do, I do. You do, I do. Only these stories I heard. The strictness and rules which made him stiff. This is the feeling of Anacardiaceae family with malarial miasm. Caught in a tight spot and attacked intermittently. He was begging his mother, I want to go outside Chennai and work. Said, no, you have to stay here only. So I gave him Ras Radicans 1M. I didn't think about, 200 at all. Because so much of anger, so much of, fighting he had within himself. 2 times 2 days, once in a month for 6 months. It took time. It was not an easy case. So this is Ras Radicans, belongs to Anacardiaceae family. Interesting one thing I learnt. See, always they say, no, single, same mother-in-law, 4 daughter-in-laws react differently. So his younger brother followed his father's footsteps. He was also very strict with his wife when it comes to family rituals. Before marrying only, he told his wife, you have to get up at 4 o'clock every day in our house. By 4:30, 4:45, everything should be puja, things should be ready for us. And he was blessed with a baby girl after 1 year of his marriage. It didn't disturb him at all. But only for our patient, it was a big problem. After 6 months, he consumed his marriage. And later he became father of a baby boy. Now that boy is 5 to 6 years old. I am still in touch because I am treating that boy for small cold. I understood, as I told you, pulsatilla, which belongs to psychotic miasm, very secretive, help her to come out of her problem. Nobody knew in her family that he is not performing. She just kept quiet because she had PCOS. Whoever thought, everybody thought. And his sperm count was proper. Nobody knew what is the problem happening between these people. She didn't had father. So she didn't understand whatever he told about father. She said, maybe fathers are like that. She had a wonderful mother. So she had difficulty in understanding him also. After all these things happened, then she understood. Then everything became all right. So this comes in Sapindalis. School age. Fifth column itself is a school age. All rebels. In that double school age. This is also school age and fifth column also school age. Column 5 is stage of relationship with the father and the relationship with the others. Within this subclass, the individual is developing in their work, profession and career. I and the other. Development of superego. Rules, hierarchy, borders, limits, stiffness and masculine elements. Laws and limitations. Resentment and soreness. He used to hate his father. His father developed cancer. The pancreatic cancer. He, after, he was blessed with a boy, his father died. I think within 6 months he died. About Rus radicans. They feel suppressed by family or partners. By a tyrannical and alcoholic father or a nasty stepmother. They feel neglected, used, abused, despised, being treated as an outcast. Often they are maltreated and abused by their father. They can feel humiliated, put down or belittled, or they can start doing into themselves. But he's a wonderful father to his child. I feel so good, So this is the end of our presentation. Hope you all liked it. So more you learn, more you see new things. This is my mantra. As I always tell, everybody make fun of me. Why are you still learning things? Because if I learn more things, I can see more, more things in patients also. And I can help more people. So happy learning. Any questions?
Wonderful. Wonderful, Dr. Jyothi.
Thank you. Thank you
Excellent.
very much.
Excellent,
Run
Dr.
your
Jyothi.
slide. Can you run the slides of first two cases, please? I joined late.
Wait.
Excellent.
Latecomers need to treat me.
Oh
Okay?
yeah, welcome.
I am coming
Welcome.
to Delhi.
चिकमंगलूर
पार्टी करेंगे पार्टी.
पार्टी करते हैं ना, आ जाओ.
Thank you
We are
so much.
meeting with
Excellent. Excellent cases,
Hey.
Shada.
Thank you very much.
Nice.
Actually,
Welcome,
no,
Dr. Jyothi. Come and stay
everybody
with me.
can see such cases. You just be open. मैडम मैं कहाँ से शुरू करूँ? यहाँ से?
हाँ, you started from this, na?
Yeah.
हाँ, just run the slides. Thank you. I'll take
This
some
is one of
screenshots.
the
Thank you.
best case. Very good case. I used little meditation technique also because she was not going anywhere. Then I told, go in little deep and tell me what you are seeing and all. Then in one point, there was a big smile in her face. She told me, I think it is the uterus which is causing me a problem.
Yes. Ma'am, this meditative sessions with the patients help a lot. I too use
Very
them
much.
very regularly. It really, really helps a lot.
Yes. And they open up, no?
Yes.
Yes.
Easily out of it.
Yes.
Easily out of it. They also feel very relieved.
And the smile they give, no?
Yes.
That sheepish smile. Oh my
Very true.
God. They
Yeah.
say.
Yes. Yes.
Nice, that is. ये बिंदु मैम ना बहुत काम लेते मैम आप ये पढ़ो बस. It will give you full case analysis.
Okay, okay. As my teacher says.
Oh, come on.
मैम ये पीएम मेथड को बहुत ज्यादा सीखना पड़ेगा, जो हम लोग रेगुलरली जो यूज नहीं करते हैं एंड गो बाय द अदर ट्रेडिशनल अदर मेथड्स. तो ये पीएम को सीखना पड़ेगा बराबर से, सिंस योर ऑल द
Yes.
केसेस वर बेस्ड
Yes.
ऑन this
I highly
itself.
recommend it. I highly recommend it.
He
After
highly
years of
recommend.
practice, I'm studying it, and it's just like opening up every day.
Hmm.
And
Hmm.
it's
So many remedies we are coming to.
Hmm.
See, there is one more thing which I always tell. Patient give you so many informations, no? We don't know some of the informations where to put.
Hmm. Hmm.
So that you learn only if you learn PM.
Hmm.
A lot of courses we are doing, no? Either you
Hmm.
join IPEMA or you join ITC, you join this healing harmonica courses. Musing is also conducting lot of PM courses.
Yes, yes, yes.
So you
yes.
can join some. Ek saadi kam le lo, but join some courses. That is what I say. We are all keeping all the things inside this. That is why, that is what I am doing. I am not buying things now. Materialistically, it is full. Jarurat nahi hai. So we do more courses, learn more things. Homeopathy is a big treasure, no? Those gold
you
and
earn more
diamond we will
sarees.
buy.
Then you can earn more sarees.
Yes, absolutely.
Yeah. So start, joining some courses, learn. Homeopathy is vast. And
Very
some of the
vast.
remedies, one of the seminars, somebody was asking other person, Borax belong to which kingdom? Now, Borax, we talk like this because of the courses, no? In which school it is taught how Borax needs to be used. Only because we are learning all these contemporary methods. Now you ask, where that laxuis comes? How laxuis is related to sulfur? How lac equinum? I didn't know lac equinum before I joined all these courses. So many new things you will learn. So this which is not taught in colleges. Very unfortunate. So start learning new things. So you can help, many people.
Ma'am, just one question. What is your thought when we do all this? This also means a lot of matrimonial remedies. So, so with PEM, how would you link, or your thought would be for a matrimonial remedies to be understood?
Actually, they talk that, no? Patients speak matrimonial remedies. See, you think hydrogen, you think lac humanum, you think then gradually you come into the matrimonial. So that is why I am telling. Start learning, then you see cases.
Yes, yes. Very true.
Yeah. All the best.
Thank you, ma'am. Thank you so
Yes.
very much. Great
I
learning today.
am leaving everybody early so that you can enjoy your coffee and tea.
Yes.
Thank you, Dr.
Yeah.
Jyothi.
Thank you.
Thank
Thank
you.
I'll be
you.
waiting for you. I will be waiting for you.
Yes, yes. We are having chai and samosa with Jaya cream.
Yeah, yeah.
Okay.
Thank
Okay.
you.
Bye
Thank you.
bye.
Thank you so
you
much.
much. Yeah.
Thank you
Happily.
so much, ma'am.
Yeah.
Thank you so much. It was wonderful session and so
Thank
much
you.
of learning. Thank you.
Thanks for the opportunity. Thank you very much.
Looking forward to learn more, ma'am.
Yeah. Thank you.
Okay.
Bye
Thank
bye. Yeah. Bye.